Hello, everybody, and welcome. Here we go. We're going into week number 5. We're talking about week 4 injuries in the NFL. Welcome to IRG's Start or Sit Fantasy Football Podcast. Again, what we do here is we're going to talk about the injuries in the previous week, talk about is that player going to go the following week, which is going to be week 5. Joining me, like always, and so glad to have you on board, is Dr. Chris Hawkins, orthopedic surgeon, sports medicine specialist, and a predictor extraordinaire as the return to play and activity. Dr. Hawkins, how you doing?
I'm doing great, Shannon. It's always a pleasure to get on and get excited for the weekend games coming up.
Yeah. We're going into week 5, and I was looking at, it's an interesting year in the NFL. Majority of teams, I can't tell you how many teams. I looked through the standings, and there's a lot of teams that are 2-2. I think we're down to only 3 or 4 teams that are 4-0, and I think we have 1 or 2 teams that are 0-4. So there's a lot of people in the middle of the pack. And as we look at the season and only going to week 5, we got how many more games? At least 10 or 11 more games to complete the season. Teams are starting to look at where they're lining up. I mean, the goal for any team is getting the playoffs and then progress in the playoffs. And early on in the season, when you start looking at these injuries, sometimes these teams are going to say, well, let's hold this player out. Let's make sure they're healing properly. So sometimes it's more strategy than just the injury itself. You know what I'm saying here? Don't you agree?
Yeah, I think one thing that you're seeing, and it's not called the same thing, but, everybody talks about how in the NBA they got into load management, how they would sort of rest these guys for the end of the season. It's not quite the same yet, but you're exactly correct, Shannon. I think the staff, the coaches, the general managers are all just backing off on the idea that every kid should run through a brick wall every game all season long, and starting to realize, if we can hold a team together, we can be in the middle of the pack and have a chance to make the playoffs. We want all of our best players at 100% once we get to the playoffs. So I think you're starting to see that factor in.
Yeah. And then like we said, we talk about biology, and healing a lot of times is just biology. It just takes the body time to repair itself. And you look at something like a hamstring strain or a quadricep strain, I mean, that sometimes will take 4 to 6 weeks. So you have to anticipate, where is this team going to be at in 4 to 6 weeks? So we start to see some, not just the injury, but also some strategizing regarding how we're looking in our lineup. Let's talk about our first player here. And interesting enough, this young man, I think he set out predominantly, we talked about him last year, he set out most of the season last year, and that's Anthony Richardson, quarterback, Colts. This guy is got the injury bug again. Oblique abdominal strain, they call it. And so I looked it up, kind of reviewed it. What do you think's going on here? It looks like it's kind of a day-to-day thing. We know how hard it is when those core muscles, those abdominal oblique muscles are injured, particularly with a quarterback. What's your take on Anthony Richardson, Dr. Hawkins?
Yeah, I think initially they were more concerned that he had some type of a hip pointer injury. He got taken down pretty hard. He got hit directly on the side on the tackle when he was scrambling. And, I think what ended up fleshing out is he just had some ill-defined pain, and probably over a couple of days they've identified that it has more to do with that sort of core abdominal muscle and the stabilization that goes into it. So he apparently has been coming along pretty well with regards to his rehab. They have had him practicing a little bit, which is encouraging that he'll be able to play. He is one of those quarterbacks that relies a lot on his scrambling and his movement. So I think if he does play, which I would say he's going to be a start this week, I think he may be compromised with his ability to be productive as a runner. But if he's smart and he stays in the pocket, I think he'll have a decent game this week. So I think he'll be a start.
Anthony Richardson, a start. The only thing to keep an eye on with him is he has practice. He has participated in practice. They are taking on, I believe, the Jaguars, and the Jaguars are 0-4. So, but we think he's going to start still. That's what you're thinking also? So even though they're playing, like I said, the Jaguars, he'll still start?
Yeah, I think when you look at where they are, I think they want to win this game, and I think they want to try to, stay in a positive thing. And because the Jaguars generally don't have a great defense, I think that leans into the fact that they'll keep them in there. Yeah,
they're currently, the Colts are 2-2, so I think you're onto something there. Rashee Rice, man, this guy, wide receiver, Kansas City Chiefs, they're already down Pacheco. That was that 2 weeks ago. He's out. Kansas City looks good. They are 4-0 right now. I believe they've got the Saints. I thought the Saints were looking pretty good this year. They've got the Saints coming up this weekend. He is out for the season. He's got a torn ACL. That's what I'm hearing, and that's what is kind of word on the street. Are you in agreement there?
Well, the interesting thing, Shannon, is they've actually backed off a little bit. Some late breaking news on him.
Okay.
Yeah. So he, So what ended up coming out is that there was no conclusive damage to his ACL.
Oh,
now,
wow.
what they meant by that is that they're not certain right now that it's a complete rupture. So the thought, I believe, is that he may have sort of a partial injury to his ACL, and some of this is a little bit of speculation on my part, but I've seen a lot of these injuries where a guy goes down, has an injury, they get an MRI, they see some bony bruising that suggests that the knee was twisted, that it puts some stress on the ACL, but you can still see that it's hooked up from point A to point B. So a couple of sources have come out and said at this point they're not saying it's a season-ending injury and that they're going to be essentially working through some rehab with him. So he's going to be out an extended amount of time. But I think their hope is that this was sort of a partial sprain of the ACL, that the fibers are good. And so typically, as you know, they'll kind of go through that whole process of decrease the swelling, work on building the muscle strength back up, and then probably see how his knee responds with, dynamic activity, knowing that he may reach level 3 of 5 levels and then fail. And then they might say, okay, he's not going to be able to come back.
Yeah.
Maybe we need to do surgery, but it's not definitive. He is not going right to the operating room for this injury. So I think that's hopeful for Kansas City Chiefs when you talk about the long run, the end of the season, 8 to 10 weeks from now. But yeah, he's definitely not playing this week.
Yeah, not playing this week, but they haven't, to your knowledge, they haven't put him on IR. They're just kind of not playing this week for sure, and they're going to assess it and kind of take a look at that. This is really interesting. I don't know, for some reason, just the other day, I was thinking to myself, there was a time period, and I was hoping I was going to get a chance to talk to you about this, but there was a time period, maybe 15 years ago, orthopedic surgeons, sports medicine doctors went through kind of this period where they elected, if you had a torn ACL, a lot of them were not pushing surgery. They wanted you to rehab, and there was some data that showed if you rehabbed it the right way, it was almost as effective as surgical intervention. Do you remember those days? I mean, am I dating myself here?
No, I don't think you're dating yourself because I'm officially old as well. I think that, what they were looking at is again, what's that long-term functional outcome? And again, it was trying to take everybody. Obviously, elite level athletes were probably at another level, but no question that sort of like 35 to 50-year-old active individual who suffered an acute ACL tear. It was that whole question of, if we can avoid, the deconditioning that goes on with surgery, if we can avoid the downtime, can we build up the muscles around it? And I think I've used the analogy before, but do we have a stable enough tripod, a 3-legged chair, because one of the ligaments has been damaged? Do we have 3 of the 4 that will give enough static control, and then dynamically, muscle-wise, we can enhance it? So you're right. There was definitely that, it's like everything else. It's a risk analysis ratio, and trying to figure out, exactly, is this person going to have a more devastating outcome leaving it alone versus operating on it? So, yeah, go ahead.
No, I was just going to say, I mean, like you said, though, but I mean, when you're talking about an elite athlete, like a wide receiver in the NFL, I mean, as a surgeon, as an orthopedic specialist, I mean, if these ligaments, or they might just be irritated, these ligamentous fibers in this ACL, are you thinking that he's not going to have surgery, or if that ligament is stretched enough where it's lost its integrity? I mean, an athlete like this probably is best to have surgery. I'm just throwing that out to you. I want to get your input.
Yeah, I think it's kind of thinking of it something like a cable. So, you have a cable that has 5,000 strands in it. And if you've had an injury and perhaps like 10% of those strands are damaged, maybe that other 90% is enough to maintain stability throughout. So that's, I think, generally what they're looking at is whether this can be, strengthened and maintained that way.
Yeah, good stuff. So, but he's at least out this week and probably for an extended period of time, but we'll keep you updated. Let's remember to talk about him next week and touch base on Rashee Rice. Because Kansas City's the two big players are out there 4-0 again, going against the I believe the Saints. So we'll see how they do. George Kittle, San Francisco 49ers. I like this guy. As far as tight ends go, this is an Iowa Hawkeye, Iowa football. Is it Hawkeye? Blackhawks? Who are they? Iowa.
Hawkeye.
Yeah, there you go. They put out some incredible tight ends. He's got some rib problems. I don't know. He came out of the game. I thought I read he got hit in the game, came out, and then went back in. And I think he's day to day. I think they're assessing him in practice. What's your update on George Kittle?
Yeah, so definitely no fracture here. And he's in that situation where he has that sort of injury at the junction between the ribs and where they come into the cartilage portion towards the front. So obviously a painful thing, something that, you have to decide, can you control your core and your muscle to be able to do what you need to do. But he's always shown himself to be a pretty tough player. Yeah. So I believe he's going to get out and play. And this is one of those few injuries that they will still consider doing something like an injection before game time to make it, not hurt, knowing that it's not fractured and that, he'll be able to kind of get through the game. He'll be sore afterwards, but can participate. So I think he'll be a play this week. Interesting for most people out there who follow him in fantasy, his fantasy numbers are not nearly as high as they've been in the past, but he's incredibly important for what the rest of the team does. He's a great blocking tight end.
He is.
He's why they're able to pull off a lot of their other stuff. So, but I would still, if you've got him on your team, he can be a huge boom if he does well. So he will be playing this week.
Yeah, play George Kittle. He's tough. That's why I mentioned he's a Hawkeye. Iowa puts out some incredible tight ends, and they're good blocking tight ends. And, I think they double team George Kittle a lot, so he opens up some passing for some other folks. So, San Francisco is 2-2, and they're playing the Cardinals. I think the Cardinals are looking pretty good this season, so they probably need George Kittle in the lineup. Here's another San Francisco player. We've talked about him in the past, but I wanted to get an update because I recently read that Christian McCaffrey, San Francisco, I don't think he's played the whole season. Maybe he played the first week or something like that from my memory, but he's not been active at all. And they're saying he's got bilateral Achilles tendonitis. And I actually read that he went to Germany to kind of see what's going on. So they're hoping that he's going to be back sometime, but they don't know when. Bilateral Achilles tendonitis. And this is probably something he got in training camp. What do you think here?
Yeah, it sounds like he started off with some calf soreness, and he probably, the typical pattern for something like this is you start overcompensating to your other side, then you start to get symptoms elsewhere. So usually when they talk about the Achilles tendonitis, as you know, Shannon, it's that sort of soft tissue, that connective tissue that's going from the muscle down to the thick part of the tendon at the bottom, and it's very innervated, a lot of nerve fibers, so you get this situation where you could have a stone cold normal looking MRI and yet have some pretty debilitating symptoms in these situations. If you're a normal person like you or I, you just kind of shut everything down for 6 to 8 weeks, and then start working on things. But now they're really struggling with what to do because this did hit him right before the start of the season. He didn't get any regular season playing time, and I think the whole idea with him going to Germany, I tried to look into this a little more. Germany is known for allowing more specific stem cell treatments than we do here in the U.S. And so I believe, I don't know this for certain, but I believe he went to get some opinions about whether that might accelerate his healing. And the take home is they did not decide to do any of that. So I think they're hopeful that he's just reassured that he can try to advance his training protocol. They've talked about starting some light running activity with him and see if he can slowly be advanced back. But nothing, if you go down that stem cell therapy thing, you're probably done for the season because they have to do that injection and then a very specific rehab program afterwards.
That's right. I think I read where don't expect him to be back until sometime in November. They're going to take their time. Again, the 49ers are 2-2. I don't know what their schedule looks like between now and November, but they definitely want him back probably mid to latter part of the season. So he's out most likely until sometime in November. That's Christian McCaffrey, running back. And he was on fire last year. He had a heck of a year last year. He was a big part of that. I watched the 49ers the first or second game of the season. I can't remember who they played this year. And I thought to myself right there, who's going to stop this team? Look at this team. Look at these weapons. And here they're 2-2. And it's interesting. Some of the parity in the NFL this season. Good stuff. Achilles tendonitis is not easy to treat, by the way. You're talking to a physical therapist that has seen a ton of Achilles tendonitis, and it is a difficult thing to get patients around the corner and get them turned. It's an area that it's difficult to mobilize. It's an area that's difficult to stop activity on. It just, again, one of those biology things. Jonathan Taylor, mild high ankle sprain. Here we go. We got the definition: high ankle sprain, mild. Jonathan Taylor, Indianapolis Colts running back. I believe this young man was injured last year also. I can't remember what it was. Was it a knee last year? Did he have an ACL? I'm going off memory. I'm probably wrong. Do you remember what it was, Dr. Hawkins, Jonathan Taylor last year at all?
Yeah, no, he had the similar, not necessarily high ankle sprain, but he had a similar soft tissue based thing, nothing surgical, and had that same issue where he kept trying to kind of get back from it. And I believe it was his ankle actually last year. I do not know if it was the same one, but obviously that's a little bit of a concern for him that he's starting to, I don't really know what they mean by a mild high ankle sprain, because usually once you get into a high ankle, it's usually more of a major injury. So I'm hopeful for his sake that this is just an irritation of his old injury, perhaps something where, that soft tissue has become a little irritated, so they're just being careful with it. It does not appear that he had a major, that tackle twist injury like we've seen guys where the defender falls on them and they pivot their foot out. So I'm hopeful that this is actually just a mild aggravation of something that took a lot of time to heal last year, and they're just being cautious with him. But I think we have to keep an eye on him. I do believe he's still in the area where they're going to play him. He's had some meaningful games, but I think what they're going to do is kind of load manage his practice to try to have him ready for things week to week.
Yeah, and so you think, and I agree with what you're saying. I think the consensus is, they're working him towards playing. Look to him to start this week. Again, the Colts are playing the Jaguars. The Jaguars, again, are 0-4, but we think Jonathan Taylor is going to go. The Colts are 2-2. I think they need this win or want this win, and he's a go. Is that right? Is that what you're thinking?
Yeah, I think that's super important. And they're definitely, they're in a place as a team that they have to be worried about, the rest of their conference getting too far ahead of them. That's the thing. There's a lot more strength in the AFC this year.
Yeah, you got to have those wins. Home field advantage is important in the playoffs. And again, we talked about this earlier in the podcast. I mean, although you're just talking injuries right now, it's getting at that time of the year with the amount of games that you start looking at what is going to be looking like 5-6 games out where we're going to be at. Hey, New York Giants coming to Seattle, Washington. The New Yorkers, the Giants, are coming to Seattle on Sunday to play our Seahawks, but they may be without or have to sit Devin Singletary, New York Giants running back. He's got that notorious groin tear strain. Let's talk about Devin Singletary.
Yeah, the word on the street right now is that he'll be sitting this weekend. So, that to me always raises some concerns. We've talked about how groin injury can be an all-encompassing diagnosis, and then it could be as simple as a mild hip flexor strain, but it can also be as significant as one of those sports hernias where it's sort of a pelvic floor injury, and those can turn into, long-standing problems problems and major surgery. So he is already pretty much on the sit, place for this week. And so that's important for the fantasy people out there. They have a rookie. His name's escaping me as their backup running back. But if you think they have a chance against Seattle, which I'm not really sure with how the Giants are playing, whether, they're going to get much of anything going against Seattle. But if you think they have a chance, you should pick up that backup running back for this week. Not to jump over to somebody else, but, they have that outstanding rookie wide receiver, Malik Neighbors, who had a concussion this past week.
Oh, yeah.
So he just had that, kind of got tackled, came down a little awkward and hit his head.
Yeah.
So he has not even progressed out of the phase 1 of his concussion protocol. So, that I think for Seattle fans, it's going to be a good week. You got a down team that's out 2 of their best players offensively. So it should be a good week for Seattle, but the Giants are really going to be hurting. And I think, Singletary will be out and Malik Neighbors is 100% going to be out because he hasn't made it even to the second step of his concussion protocol yet.
Good call. Yeah. I like the Giants. I like the Giants coach, Brian Dabble. I like him. I feel bad for him. He's 1-3 right now, and coming into Seattle at 1-3 with the potential, good chance Seattle's going to win to go 1-4. And I think I read something the other day. I was doing some research. These teams are so involved in statistics, right, and analytics, so to speak. And I think I read something that if you go to 1-4 early in the season, your chance of making the playoffs at 1-4 is you're down around 3%, right? So these wins are important as far as the playoffs go, sometime based on data. So Devin Singletary's out, and the receiver Malik with a concussion is out for the Giants. Okay, Bijan Robinson, Atlanta Falcons. I like the Atlanta Falcons this year. I think I told you I like Kirk Cousins. Kirk Cousins had a Achilles tendon injury, tear actually with surgery, I think mid-season last year. The Vikings traded him to Atlanta. I saw him play a couple weeks ago. He looks pretty good coming off an Achilles tendon repair. But his running back is got a hamstring irritation strain, and they're talking about day-to-day stuff. They're taking a look at him. What's the lowdown on Bijan Robinson?
Well, like all those soft tissue injuries that we talk about, Shannon, they're always a little questionable, but everything's pointing in a promising direction for him. He was limited with some of his activity in the game, but he did continue to play. He's been practicing this week. And so at this point, I think you're going to be able to keep him in your lineup. And he's probably one of the top 3 or 4 running backs in productivity. So I'm pretty sure he's going to be starting this week. And I think they're just, again, kind of load managing his practice time just so that he doesn't irritate it. But he's got, he's young. He's got the sort of the positive things that usually allow you to bounce back from these things relatively quickly.
Yeah, I think I think I read something on Atlanta. Did Atlanta play last Thursday? Did they play Thursday night? They may have a bye this weekend. I don't know. I thought I read where they have a bye. So if they have a bye this weekend, he may be out anyway. But going forward, it could take a couple weeks. Jensen, do you know what that looks like? Confirm that. Atlanta's schedule. I thought I read where they. Do you know, Dr. Hawkins? Does Atlanta have a bye?
Yeah, I don't know offhand.
Yeah. Well, if they do, the thing is, keep an eye on him because we don't know the extent. We don't know what the grade of the hamstring injury is. If they do have a bye, good for Atlanta, good for Bijan. If they obviously they're going to play next week. What's it say? I can't read Buccaneers. That. They play the Buccaneers. That's tomorrow night. Okay, there you go. They play the Buccaneers tomorrow night. So he's definitely keep an eye on him. Now that we know they're playing the Buccaneers tomorrow night, Dr. Hawkins, in or out? What do you think? Sit or start?
He's going to play.
He's going to play. Okay, there you go. There you go. Wonderful. That's we're talking about week 4 injuries. Looking forward to week 5 in the NFL. Our Start or Sit podcast with Dr. Hawkins. Again, we're talking about injuries and we're identifying the type of injury, the rehab, what it's going to take, and looking at that fantasy football player for you fantasy football folks, so you can get your lineup set. Dr. Hawkins, great job. Once again, enjoyed it. Love talking to you. You got great insight. Your explanations, what you do is fantastic. And I appreciate you partaking in our Starter Set podcast, okay?
Yep, it's always a pleasure for me and a good time. Thank you, Shannon.